Now to discuss the different scenarios when to use visual supports. A choice board. Joe is an 8-year-old boy with ASD with an intermediate profile. He has a difficult time understanding which reinforcers are available and when they're available. He engages in problem behavior when he gets stressed out when he doesn't know which reinforcer to choose. Sometimes he often demonstrates problem behavior during a DTT session at the table when he is asked, "Joe, what would you like to work for?" And sometimes he engages in problem behavior because he doesn't know what he wants. To eliminate the problem behavior at the DTT session and other times where he needs to make a choice, Joe would be best fitted for a choice board. Young children and adolescents are required to make multiple choices each and every day, and it empowers them, it motivates them, and it helps them with their self-identity. If a learner with autism cannot make these choices and they're not given the resources to make the choices, it can be detrimental to their self-identity and their further choice making. It is important to provide learners with autism a choice board to allow them to make choices that empower and motivate them. A visual schedule. Lily is a 4-year-old girl. She's nonverbal and she has ASD. She has a difficult time transitioning from location to location at her local IBI sessions. There are many different locations she could be at throughout the session. She could be at the DTT table, she could be at the snack room, in the gym, in the craft room, and the bathroom. Seeing as there are many different locations Lily can be in throughout her session, a visual schedule would likely help Lily knowing where she is going and how to make her transitions easier. Visual schedules provide a representation of what's going on and where the next location is going to be within a certain time frame. This can allow learners to understand where the next place they're going is. A visual schedule can be particularly helpful when learners have a difficult time leaving a preferred location or activity. A visual schedule can demonstrate the next preferred activity or location that they are going to go to. A visual schedule can allow the learner to visually see the next preferred location and where they're going to go. This can make transitions a lot smoother and a lot easier for the learner to remain calm during these transitions. A pictorial task analysis. Jimmy is a 15-year-old boy with ASD and he's considered high functioning. However, he has a difficult time following multiple step instructions. For example, he has a difficult time washing his hands and making food in the kitchen, as both of those skills require multiple step instruction. Task analysis can decompose a large skill, such as making food in the kitchen, into smaller skills where he can complete the skill step by step. Sometimes task analysis has photos beside each step, and sometimes it is written, and that all depends on the learner's ability to understand the steps. This type of visual support will help Jimmy make a sandwich in the kitchen or wash his hands, as he will be able to have each step laid out and he'll be able to follow each step individually. In other words, this type of support is usually used when learners with ASD are getting older and they require self-help skills, such as washing hands, getting changed, and making food in the kitchen. Now that we have discussed different scenarios of which visual schedule to use, I want to go over the pre and post test. So the pre-test was the first 5 questions we talked about at the beginning of the training. The post test is those 5 questions plus 5 more. So I'll just go through the post test questions and you can take a pen and pencil and you can write down your answers. What is autism spectrum disorder? What are some symptoms of autism spectrum disorder? What is a visual support? Why is a visual support helpful? What are some kinds of visual supports? What is important to consider when making your own visual support? Why are visual supports used for children? What are some target skills required to use visual supports? And draw an example of the following visual supports: a choice board, a visual schedule, and a pictorial task analysis. And lastly but not least, which visual support do you feel most comfortable implementing and why? And if you could explain why, we can further discuss you're uncomfortable with other ones. We can discuss them to make you more comfortable with those. Thank you.